So this relates, and this basically is to do with our proposed planned intensified IEC campaign fixed for the 12th of this month. So here, this is going to be a pan-India event, and will happen on the same day. So, as I said, by way of a background, our country, India, faces a significant constant challenge in the form of HIV/AIDS, and India has a very high number of people living with HIV, and even though the national HIV PR, the prevalence rate, is low, there are approximately 25.44 lakh people living with HIV/AIDS in India, and just last, as per the official count in the of 2023, we have 68,450 new cases. So yes, and there are certain states that have shown a rising trend, including some of the states here in our northeast India, such as Arunachal Pradesh, Meghalaya. Fortunately for our state, we have been to some extent able to stabilize the epidemic, and as such, for the last 4 or 5 years, there have been no increasing spike in the graph. And presently, however, we still stand at the, as per our prevalence rate, Nagaland stand at number 2, only next to Mizoram. And presently, we have a prevalence rate of 1.34. So, in order to enhance the knowledge levels of awareness to our general public, this intensified campaign is going to be held, and this is going to be following the launching program. This is going to be a 2-month exercise. So this is intended to reach all nooks and corners of our state, and the key objective of this entire 60 days program is to, and as I said, is to enhance the knowledge and understanding for the general public. Number 2 is to promote safe practices and reduce stigma. So, as you are aware, the major step that we can take towards creating awareness to our public is through this kind of awareness activities, and as is obvious, this can be achieved mainly through our media. So under IEC, a lot of activities have been planned, and in detail, our concerned program officers will dwell upon the details, the activities. However, there will be broad-based two types of category based on which all these activities will be carried out. One will be rural activities and one will be urban activities. Under the rural level, we will have village level meetings and HIV awareness. Then we shall be having school outreach programs in all villages as in we have shortlisted 780 villages. Then we will be disseminating information on HIV, STI through our IEC materials. We shall be having interpersonal communication sessions with village health, sanitation, nutrition days. In the category of the urban level activities, we shall be having, it shall be launched through a rally. Then we will be having flash mobs and awareness sessions in all colleges, especially through our RRC, the Red Ribbon Club agencies. We shall also be having special camps at government hospitals and also sensitization programs for our ombudsman and complaints officers. So, as I said, to go into the details, further details of this, I will now give the time to our Deputy Director, IEC Division.
We will be having campaign activities at the rural as well as at the urban levels. And this rural levels is planned at 780 villages in Nagaland. And this will be conducted by our field functionaries at the district. And this will be done in coordination with the district administration and village council. So, because for this campaign, we will require and we really need the support of our district administration, including the village council, because we are going to have village level meeting on HIV and STI awareness. We will also be performing folk performances by our BZ Entertainment. The selection has been done. So they will be going to the villages and performing folk media, through which awareness will be generated amongst the villagers. And also, we are also going to have school outreach programs at the village level and disseminating information on HIV and STIs at the village through IC materials and including the interpersonal communication sessions. All these things will be done at the village level by our field functionaries in coordination with the district administration and village council. And at the urban level, as mentioned earlier, we are going to have a rally, and then the state level rally is going to be organized on the 12th of August in commemorating the International Youth Day, as well as the day of the launching of Intensified campaign. So this activity will be done, and all these things are being done to create awareness so that we can all come together and disseminate as much as information to the people. And our main objective is to create as much as information and awareness within the span of 2 months. So we have this specific period of time given to us so that we can at least reach out to maximum people. And then we are also going to have flash mobs and some awareness sessions in colleges through RC. Because of this, our preparations are going on we're starting from the Kohima zone, and this Kohima zone youth convention will start from 12th and 13th. So the very purpose of training the RC delegates, the delegates will be coming from 7 districts. So the very purpose of training these delegates is that they will be trained as HIV ambassadors, and when they go back from the youth convention, they will create awareness. They will carry out awareness sessions in their respective colleges and institutes and wherever possible amongst their peer members. So this is the main objective of having this youth convention, which will be from 12th to 13th August. So this is also included in our Intensified campaign, which we are launching on 12th August. And then the other districts will be covered in other 2 zones in Dimapur and Mokchung, which will be planned out and conducted shortly. And the rest other districts will be covered under those 2 zones. So we have different kind of activities, and like our sir has mentioned, the special camps at government hospitals and sensitization of ombudsman will be done. And we have, because of the social media influences that is present at the moment, we have social media activities extensively being carried out during this 2 months period, and we have chalked out in such a way that this will be carried out on daily basis for 8 weeks. And the themes that we are going to touch upon are the routes of transmission and prevention strategies, myths and misconceptions, risk perception and promotion of services, promotion of national toll-free helpline 1097, condom promotion and safe sexual behaviors, STI prevention and treatment, substance use and drug abuse, stigma and discrimination. So we have 8 themes, thematic areas, which will cover almost the entire topic of HIV, and we are going to run this information through the social media platforms that we have. And we are also going to use the Red Warriors. These Red Warriors are our NSEX dedicated HIV ambassadors, whom we have also trained during last time during the Nagaland influences conclave. So these influences, we are going to use them. We are going to piggyback on their platforms, and we are going to create as much as awareness on all these themes, so that it reaches out to the general population. So this is how we are going to carry forward. This is our plan of the Intensified campaign for 2 months. We are going to cover 780 villages. So because 780 is a huge number to be covered under the 2 months period within the 2 months period, but we are hopeful that our dedicated staff field functionaries at the district can do it. And this is, we have selected 780 villages accordingly because we wanted to have maximum reach. And in Nagaland, we have total villages of 1,280 as per the census. So we are taking 60% of the entire village. So we want to cover almost all the villages, but within 2 months, it's impossible also to cover all the districts. But we are taking maximum reach, at least 60% we want to reach out, and those villages are the villages where they have less access services to HIV facilities, as HIV. Facilities at the district. So we are selecting those villages on need base, and this is being done, the micro planning is being done by our Disha team at the district. So they are selecting the villages according to the need and prevalence of HIV. Dimapur, so Dimapur covering Newland and Chumukadima, we have 129 villages to be covered. Kifuri, we have 63 villages to be covered. Kohima, including Tsiminu, we have 68 villages. Longlang, 28 villages. Mokchung, 52. Mon, 73. Peren is 52. Pak is 59. Tuensang, including Shamator, is 46. Waka is 80. Zunheboto is 102. Noklak is 28. So total is coming to 780 villages. So this is the challenge that we have taken, and I hope and we are sure that our field staff, our field functionary will do well and reach out to and try to cover all the target that we have set. This is an ambitious target that we have, because 780 is not a joke also, right? Yeah. So, but under this campaign, we are taking this challenge, and we are ambitious, and we are very enthusiastic that it will be done. We'll be able to reach out to these people, to these villages. Yeah.
If we consider the absolute number, like for example, say a state like Maharashtra, it has more than 3 lakh people living with HIV/AIDS. Whereas in Nagaland, we have precisely 14,113. That's the latest tally. People living with HIV/AIDS, in a sense, people who are also under medication. So the reason we have been able to a large extent, stabilize this epidemic is because of the consistent efforts of our state machinery specifically under the organization of ANZACs. In that context, at the beginning, I was just enlightening you, in a sense, sharing with you regarding the increasing trend of some states in the mainland also, and then in the northeast also. But fortunately, our state has been able to keep it at a stabilized status.
Will be associated with the launching of Intensified IC campaign on the 12th at NBCC Convention Hall. So on the day, we are expecting around 2,500 students and delegates. So this, we are going to have different kind of activities on the day, like exhibition stalls and photo booth, selfie point, HIV and syphilis counseling and testing, interaction with HIV drug users community, autograph signing and selfie with the Red Warriors, our influencers. And we also have games and competitions which will be done through the SDG and the Birds and the Bees talk. And we also have social media kiosks, pledge signing, and we have exciting gifts for the students who will come and, people who are following our social media pages and social media platforms, they will be awarded, they will be rewarded with gift hampers. And we also have face painting, so all these activities will be done on the day, on the 12th of August. So we want to encourage the students to come prepared and be excited for that day. So these are some of the highlights that we also want to share.